Item: SCP-329. Object Class: Euclid. Special Containment Procedures. The building in which SCP-329 is located has been purchased by a Foundation Front company and designated site. Access to the site is restricted to Level 3 personnel. Facility personnel to undergo full body scans at least every 48 hours. Since it is unknown how many adherents the Church of the Gardener possessed, site should be considered at risk of recapture and appropriate measures taken. Description: SCP-329 is a room in a derelict building Room is in the building's cellar, 6 meters x 5 meters, with a steel fire door. Room contains 6 folding beds. Beds are fitted with IV stands and leather restraints. 5 beds are occupied. Occupants are of both standard sexes and several races, with ages 1664. Occupants have been designated SCP-329-01 through SCP-329-05 and have been identified as 01. No fixed address. 02. No fixed address. 03. Former medical student at university. 04. No fixed address. 05. D-Class personnel who was subjected to Event 329A. Occupants of beds all have cancer. Type of cancer varies from occupant to occupant, but all cases have at least 3 tumors of grade T3N1M0 or higher. Although cancers are advanced, they do not follow normal progression. 2 of the cases, with a prognosis of weeks at best under normal conditions, have remained alive since at least. Occupants are alert but in great pain and unable to speak. Every 24 hours, at approximately 4 a.m., SCP-329 undergoes Event 329A. The door closes with great force and cannot be reopened for the duration of the event. Anything obstructing the doorway is pulled into the room. Event 329A lasts for approximately 20 minutes, after which it is possible to open the door again. Equipment for remote observation and recording is rendered inert during 329A in a manner consistent with a non-standard space-time event. The only sounds heard from outside during 329A are screaming from the room's occupants. After the event, occupants are apparently unharmed, bearing no incisions or external trauma. Their tumors, however, have been altered, in some cases radically. They have been reshaped and their direction of growth has been altered. 3 of the occupants have tumors of more than 20 feet in length, twining around and through bones and organs. SCP-329-05, who was cancer-free before he was exposed to Event 329A, was found after the event to have developed a T1N0M0 lung cancer, which in the 3 weeks since has grown to T3. Only people inside the room are affected by 329A. In those who have been removed from the room, their cancer progresses normally, resulting in death.